To open it up, what I want to ask, and I'll start with the two large players first, is what has really changed from your stand? Clearly, some very exciting data has been generated, in different spaces within the field. But when you have been looking now, and presumably looking more frequently at biotech companies, actually letting them in the door, because when we would do opportunity identification search projects for large biotech and pharma, the first thing they would always say is, no chemo, no cell, no gene therapy, and no immunotherapy, completely off the map. That may include some of those people that are on the companies that are represented on this panel, but I won't name them. So when you are now kind of entertaining these new biotechs, what is it that they are presenting? What is it that you're kind of challenging them with as you're having these discussions now, where before you weren't having those discussions?
You got a pen?
Well, we'll get to your side of the story on the end after.
All right, I'll give this a shot. And it's actually pretty black and white from what I've experienced. Prior to the larger pharma players gaining confidence around the immunotherapies, the data that they would have wanted to see, if they would look at anything, would have been clinical data and randomized data. That's what I've always heard. If you don't have a randomized phase 2 data, at least, don't come. Well, that has changed entirely. Most of the technologies that are now around in a freshly launched field, that's like 2-3 years old, if you count from Provenge approval, is discovery projects. Many of them are discovery projects, and many discovery deals are done. Very early stuff that is based on the increased confidence in the space. And now an added factor, the increased anxiety of missing the boat. Because now this boat is out and it's moving fast, and it is quite important for all the big players to have a piece of it. So I think that's one of the substantial changes in the space. And you see that the deal architecture that is made for most of the deals are on discovery projects, not on clinical projects. There are a few clinical programs around that have started a while ago, and they're very difficult to catch. Most of them are committed, and they're not easy to get our hands on. So I think that's a key feature. There are a few other features, but we'll come to that. Maybe Hai has something to add.
Well, just start with a disclaimer to Jeff, which is it wasn't so much whether Roche would or wouldn't allow various suitors in the door. Names. It was whether or not, the amazing thing is that they let me in the door, because I really came at this already as a zealot. And so I had clearly quite a bit of convincing to do within my own organization as to why we were taking such a sharp left turn from the small molecule, signal transduction, targeted pathways, et cetera. Not to say that those are abandoned, but rather that there was another way of looking at the problem. I definitely agree with Axel's comment about being interested in earlier stages of discovery and development. And in fact, Paul may reflect on the fact that when we had our discussions with immatics, it wasn't to say that we weren't interested in their later stage assets. I think they're very exciting, and we are all optimistically but cautiously looking forward to the data. But we wanted to get in at the beginning. We really wanted to be able to bring to bear not only resources, but our own creativity to be able to marry what is strongest about what a biotech brings with things that it may lack. Whether those things are reagents, assays, or technologies for assessing outcome, or other contributions that relate to experience with clinical trial design, et cetera, et cetera. So part of the drive for going early was that we as collaborators in this venture want to be able to contribute. And I think that we've seen that message again and again with the partnerships that we've tried to forge. I also agree that the cut and dry assessment of an asset's value as to randomized phase 2 data with a survival endpoint, or at least a progression-free survival endpoint with hopefully a few PRs and a CR here and there thrown in, is no longer. I mean, it's certainly, if it's there, we want to see it, But we've actually gone out and asked companies, could you tell us, do you have biopsies from any of your patients on therapy? And did those biopsies show any induction of inflammatory infiltrates that weren't there in pretreatment biopsies? And so, and sadly, usually the answer is, well, we don't have the answer to those questions. But we're going to make sure we get the answer to those questions as we go forward. So, thank you.
Thanks, Hai. So I didn't actually put up any deal-making data here, but